children to school.
Congratulations.
So
and how concerned were you
okay
about doing that?
Well, I think we just don't have a choice. As I've been saying all the time, we have to learn how to live with the corona. And I've heard a lot of people say, well, why not put it off for another week, for another 2 weeks? It won't help. We have to start getting them back into school, test them. I think one very important step is to get the kids who can get vaccinated in the schools. We have quite a high percent of children 12 to 16 or 15 that are not vaccinated yet. And in schools, we can do that. So I think that would be a very good move to really get the kids into school and vaccinate them there, and see to it that also the older kids, over the 16 to 18 kids, also I think are only around 80% are vaccinated. So we can get up to 100%, get them vaccinated. These schools are a really good setting to get to these kids and vaccinate them. The younger kids are a problem because we can't vaccinate them. But again, I think that it won't help leaving them at home. Okay, and the rise in numbers of positive results of PCR and generally just people with children with the disease, 50% of them are children. So I think a lot of this peak that we're seeing in the last 2 days is really due to going back to school. So as Nachman Hash said, I think we'll see a rise in the next week, and then it'll start dropping off.
Looking again at what's happening around the world, what do you think poses a good model to how Israel could operate with regards to vaccinating children in schools?
Well, I think that we in Israel, we have a lot of experience in vaccinating children in school. So I don't think we really have to, learn from other countries. We know how to do it, and it can be done. Schools, again, are a great setting to get to all the kids. 100% of kids or 99% of kids come to schools. So I don't think that's a problem. Maybe the parents have to be convinced to vaccinate them. But I think that nowadays we're giving enough carrots to parents and families to really make it worthwhile for them to get the kids vaccinated, and then them themselves.
Yet again, looking at the numbers just from yesterday, for example, more than 10,000 infections across the country, and Nachman Nash is saying we should expect numbers to rise with the opening of the school year. But then he says the curve will change towards the end of next week. What does he base it on, and do you share the same sentiment?
I'm sure that is what is going to happen, and just from looking at who exactly are the people that, or the cases, the positive cases, 50% of them are children. So that means a lot. Okay, so really the 50% of the cases are children who tested just because they have to go back to school. So I expect that after testing all the children, we'll get a peak, and then it'll come down.
Okay.
So I think he's correct. He is completely correct.
As a grandmother, I don't know how old your grandchildren are. I wish them, of course, a very successful day today. But what are some of the guidelines that you gave to them that you recommend parents give children on this first day of school?
Well, I don't know if you can really tell children how to behave. I'm talking about small children, not the teenagers. The teenagers, first thing, get vaccinated. But you can teach children, teenagers or younger adults to keep a distance, maybe not kiss and hug as often as they used to do. That's one thing. But the smaller kids are a problem. I would like to see schools try and decrease the number of children in classes. I think that we didn't do enough in that way. Our classes in Israel compared to the world or the OECD are very large. The classes are small, so kids are really, very close to each other when they're at school. I think that's a problem for the future also, and I don't think we've done enough in that way of really trying to make classes, less children in one area, in one closed area.
Professor Orna Epel, thank you very much for joining us.